Good afternoon, everyone, or probably not good morning, but good afternoon, yes. Welcome and thank you for joining us today for this special webinar, United for Resilience in the Healthcare Sector, Strengthening Support for Formal and Informal Carers and Leaders. We're so happy today to bring together three sister projects, Support for Resilience, WellCare, and Apollo 2028, to explore how we can enhance resilience in healthcare. So today's webinar will focus on the critical need to support both formal and informal caregivers, as well as healthcare leaders who are facing increasing pressures across the sector. Our healthcare system, as you all know, is under tremendous strain, and at the core of this pressure are the caregivers, both professionals in clinical settings and informal carers looking after loved ones at home. Alongside them, healthcare leaders have the task of supporting these teams while managing complex challenges themselves. Today's event will look at ways to strengthen the support structures around these essential roles to build resilience and promote well-being throughout the sector. All three of these sister projects, Support for Resilience, WellCare, and Apollo 2028, have been funded through Horizon Europe, and a particular call designed to tackle the immense challenges healthcare workers face. These challenges include heavy workloads, occupational stress and burnout, all of which have worsened in recent years, especially post-pandemic. Our mandate from Horizon Europe as projects is to provide practical solutions that will not only benefit individual caregivers and leaders, but also improve the resilience of entire healthcare organizations across Europe. Quick disclaimer, I think I forgot to present myself. I'm Shalini Premachandran-Froilan. I am the project manager for the Support for Resilience project. So that was my disclaimer. What makes today's event particularly exciting is the shared vision and approach of our three projects. Each of these initiatives focuses on improving mental health, well-being, and resilience across high-stress environments in healthcare and care sectors, while addressing the challenges of long-term care workers, healthcare workers, or leaders. The common goal of all three projects is to reduce the psychological burdens experienced in these roles. All three projects adopt a holistic approach, tackling stresses at the individual, team, and organizational levels, while also focusing on leadership and governance improvements. Our focus is on providing multi-level solutions that can positively impact both caregivers and the systems in which they operate. The work in these three projects spans multiple European countries, and this kind of ensures that the solutions we develop can be adapted to different and very diverse healthcare systems. Innovation and evidence-based solutions are central to our work, whether through new technologies that monitor mental health, or whether it's toolkits designed to support care leaders. Ultimately, we aim to strengthen care partnerships, improve leadership, and influence policy for systemic change. Before we dive into today's sessions, a few housekeeping. I'd like to remind everyone to keep their microphones muted during the presentations. You're welcome to ask questions via the question and answer feature throughout the webinar, and we'll have dedicated time to address your questions. I'd like to take you very quickly through today's agenda as well. We'll begin with a discussion of EU-level policy initiatives aimed at addressing the challenges faced by healthcare and long-term workforce. Will be chaired by Claire Champagne, who's a policy and project officer at Eurocarers, and also an associate of the WellCare project. We'll hear from Sabrina Montante from the Directorate General for Health and Food Safety, and Yishi Svoche from the Directorate General for Employment, Social Affairs and Inclusion. This session will be followed by a policy discussion. After this, we move to the project presentation session, where you'll hear from the leaders of each of the EU-funded projects. We'll start with Professor Siri Vik, who is a coordinator of the Support for Resilience project, followed by Associate Professor Lennart Magnusson, who is stepping in today for Professor Elizabeth Hansen, who unfortunately could not be with us today from the WellCare project. Elizabeth is the coordinator of the WellCare project. Finally, we will also hear from Professor Irene Georgescu, coordinator of the Apollo 2028 project. I'll be moderating this session, and after each presentation, we will open the floor for questions and answers. We also will be having an interactive poll later in the session to gather your perspectives on the key challenges and potential solutions for supporting the healthcare workforce. After that, we'll move into a project panel discussion chaired by Dr. Leonard Magnussen, where our project leaders will discuss how to better address the resilience and mental well-being of health and care workers. To conclude, we'll wrap up with some final thoughts and key takeaways from today's discussions. Before we begin, I would also like to acknowledge the support today of John Favaro and the Horizon Results Booster, which is an initiative funded by the European Commission to help projects like ours maximize their visibility and impact. Thank you, John, and Julie Artesa, who unfortunately could not join us today. Thank you for your support in making this webinar a reality. We have an exciting program ahead, and let's keep in mind that today is an opportunity for all of us to connect, share ideas, and collaborate on how to build resilience and well-being across the healthcare sector. Once again, welcome. Thank you for being part of this conversation. And without further ado, I'm pleased to introduce Claire Champagne, who will chair our first session on policy initiatives. Claire, over to you.
Thank you, Shalini. Together with my colleagues, from the sister project, I'm very happy to welcome so many of you this morning and would like to thank you for your interest in these projects. Before we discover the projects themselves, we thought it would be useful to get an overview of the broader context in which they are implemented. Indeed, these ambitious projects have been made possible thanks to the EU's political will to take action to deliver on the principles stated in the European Pillar of Social Rights, proclaimed in 2017, including the right to access affordable and high-quality preventive and curative health and long-term care services. This strong ambition is reflected in various program fundings, but also, importantly, policies, which are designed to support and guide efforts at national and sub-national levels. These policies are crucial to us. They frame the context in which our pilots are situated, and they will also support the sustainability and scaling up of our results across Europe. To take us through this important policies initiative, to update us, because there are many, we are delighted to welcome this morning not one, but two esteemed representatives from the European Commission. We'll listen first to Sabrina Montente, who is a senior expert and currently a policy officer in the Directorate General for Health and Food Safety, also called DG SANTE, focusing on European semester, recovery and resilience facility, while also addressing challenges related to the health workforce. Sabrina, you have 2 decades of experience in public health policy, multi-level governance, and project management. You have collaborated with international and EU organizations, research institutions, and national and regional offices. Next, we'll listen to Jiří Svoje, a senior expert from the Directorate General for Employment, Social Affairs and Inclusion, also called DG EMPL. Jiří, you also have an extensive experience in the area of social affairs, having previously held a position at the Ministry of Labour and Social Affairs of the Czech Republic, and then served as a social attaché at the permanent representation of your country to the European Union, before joining then the Committee of the Region and the European Commission. I think both of you have a wealth of expertise, both at the EU and national levels, which is extremely valuable in guiding us through these complex policy fields. So thank you again, both, for taking the time to be with us today. And without further ado, I would like to give the floor to Sabrina, who will offer an overview of the challenges faced by the healthcare workforce across the EU and the action taken by the European Union. And then we'll listen to Jiří. During the presentation, feel free to insert your questions in the chat, and we will take them after the two presentations during a short policy discussion. So Sabrina, over to you. Thank you.
Thank you very much. So I now will start sharing my slide indeed, so I can actually then immediately introduce myself also using the slide. Thank you very much for the invitation to this online event. This morning actually fits quite well with our work and the project we support from the DG SANTE. My name indeed is Sabrina Montante, and I work at the unit C2 in DG SANTE. Unit C2 is at the unit working on the state of health in the EU cycle, then the European semester, and the health technology assessment. So it's quite large unit here in. So
you're not yet. Oh, now you are. Okay.
Yeah. I was just introducing. Now we are in the presentation. So.
Fine.
Outline of the presentation this morning. I will try to remain in the 10 minutes as requested. First of all, I don't know what is the level of understanding or knowledge actually of the participants on EU health policy and health systems, but it's important to clarify what is the framework in which we move and also the field of competence of the European Commission in these regards, just as a starting point. And then we move towards, the challenges faced by health workforce and health systems and health workforce as a key pillar of health systems indeed. And then what are the EU actions that the DG SANTE is putting in place? So DG SANTE is running the EU for Health program. The project of today are not actually funded by the EU for Health program, but there is actually rich cooperation between the different DGs in the Commission. So, and I think I find a very good idea also to consider the policy context in which these projects are running at European level. So, as I said, what is the field of competence of the Commission? It is limited. We need to start by saying that we're not asked directly managing, delivering healthcare, but it's actually the competence of the member states. However, the EU has many tools that can support health systems strengthening, and is actually been trying to use all of them actually to complement national health policies, supporting actually member states to achieve their common objectives. And common objectives are in the large ones, strategic ones, is improving public health, preventing and managing diseases, mitigating sources of danger, harmonizing health strategies between member states. So what we do is really to facilitate this exchange and to support the member state to complement action of member states in this field. After COVID-19 pandemic, I listened to Clara that mentioned the European Pillar for Social Rights, but important initiative that have been put forward by the Commission in terms of policy is actually the building a European Health Union that was launched by President Ursula von der Leyen in September 2020, and is an initiative that has been launched really was launched to address challenges that were arising from the pandemic. However, is actually including actions that goes beyond the field of cross-border threats actually, but includes also the European Beating Cancer Plan, the European Health Data Space, which is at the moment quite under the spotlight, the EU Pharma legislation review as well, and go back. And then also the Healthier Together and Non-Communicable Diseases initiatives, which put at the center really the role of prevention, for example. And last but not least, the comprehensive approach to mental health that I think will be quite of interest for you. Of course, I won't be able to talk or further address questions in each of these building blocks, because these are also followed by other colleagues within DG SANTE. But for sure, we can collect questions, and in case we can follow up also afterwards. So the recent communication on the European Health Union that was actually published in spring 2024, once again reiterate the message of the role of resilient health systems and health workforce that, are key pillar for this. And the Commission supported this actually goal of making in health systems more resilient in different ways, as I said, primarily via knowledge brokering, policy guidance, and funding. So here in this slide, I try to summarize what specifically we do in the unit C2 to support member states in this regard, starting from the role that we play within the European semester cycle, which is not, we have to say, always clear to stakeholders. We do know that, European semester, it goes beyond healthcare. It actually is a coordination mechanism, economic and social mechanism of coordination between member states and the Commission. And it is a way, it actually used as a policy guidance. The Commission used this to provide policy guidance and recommendations. And there have been a dedicated health annex for each member state in the last years, in which we highlight what is we focus on certain indicators, in particular indicators looking at the effectiveness, accessibility, and resilience of health systems, and we provide an understanding what is the situation in the country in terms of these indicators, and when needed, we provide country-specific recommendations. But also the Commission, through the European semester, published country reports, and in country reports are also highlighted different challenges. We will see later that health workforce is one of the challenges that has been highlighted through the country reports in the European semester. It's the instrument actually of the Commission to, inform or share with the member states key challenges and recommend for policy action in that specific field. Then we have the State of Health in the EU project, funded by the Commission, DG SANTE, which is a project promoting knowledge brokering and data analysis. Is led by the Commission, but this is the cooperation also the OECD and the European Observatory on Health Systems and Policies. We published through the State of Health in the EU Health at a Glance report, then the country health profiles, and also the synthesis report in which we highlighted the horizontal challenges for future attention. Then the State of Health in the EU actually will see a launch of the Health at a Glance now in November 2024. So it's a cycle, so with publication of reports regularly, and is really include data analyses that are relevant to inform policy development. And then the expert group on health systems performance assessment, which is a group that is co-chaired by the Commission and member states, that looks at national health system performance assessment framework, which are framework of indicators looking at performance of the healthcare systems, in which experts from member states are exchanging knowledge about these frameworks. But in the last years has been expanding its role, actually using this group also to exchange policy and any other knowledge that can be interesting between countries on specific subject. And one of it is actually health workforce. In fact, member states has identified within this expert group health workforce as one of the priority topic. And then last but not least, the funding. So the big instrument the Commission has is the funding through the EU4Health, but also Rise in Europe and other framework program. In particular, we can say that from DG SANTE, what we follow is the EU4Health programs, in which we have funded several projects that I will show you in a minute on health workforce in particular, looking at planning and retention, and also more recently with a particular focus on nurses. So here we have a slide in which rapidly you can see what are the EU funding instruments. On one hand, we have a funding instrument supporting the collaborative transnational project like EU4Health, Rise in Europe, and so on, but also On the other hand, it is important to remind participants that also we have other instruments that directly fund national and regional projects, like, for example, the EU cohesion policy funds, but also more recently, the Recovery and Resilience Facility, with approximately 43 billion budget spent on healthcare in 27 recovery and resilience plans, so a quite substantial budget, in which we funded action that tackle, let's say, country-specific recommendations. So here we see the role of the European semester. And part of it are, infrastructure gaps, primary care reinforcement, digitalization needs, but also workforce shortages, challenges and actions to respond to that. So let's move to talk quickly about the health workforce challenges with a few slides, just to show you the extent of the challenges that we are facing. We see in this slide from Eurostat the rising of the population over to 85 between 2014 and 2020. We see that there has been also an increase in number of nurses and physicians across the EU, but even if there's been an increase in the number, in the absolute terms, this is not enough to cope with the challenges of the increasing number of aging population. So these require a big attention. And we also see, and I wanted to share with you some numbers on health systems, that is actually the 11% of the GDP, of the total GDP in average. This is the data from 2021. 15.5% of the total public spend, and 8.6% of the workforce is actually a health workforce. So it's really a big segment of the labor market in the EU. But although this is a big segment, it is not enough to cope with the challenges. So we need really to find solution to address that. Here we see the slides quickly in which you see also the diverse distribution of nurses and doctors across the EU. These are recent data from the OECD, in which you can see there is an average of 8.4 nurses and 4.1 doctors per 1,000 population across the EU. But there are countries that face challenges of shortages for both, let's say, categories, others just for one of them. So we have to look at really the different context that require also targeted solutions. But what we can see that in general, in all country reports in 2024, we had actually health workforce as a challenges across the EU. So in all EU member states, so in a different extent with big variation, but this is the challenges that the member states are all facing. So what are the actions that DG SANTE is putting in place? So it is important to remind participants that actually, of course, the COVID-19 pandemic put actually under the spotlight the role of health systems, the role of health workforce. But this is something that is not actually starting with the COVID-19 pandemic, what was actually pre-existing much before. And in fact, already during the third health program, which is the previous public health program coming before EU4Health, the Commission funded health workforce project with a cluster of 5 projects focusing on medical desert, task shifting and workforce retention. But then later with the EU4Health actions, we continue funding. We also had an additional dedicated joint action. There was a joint action health workforce even before EU4Health, but there is a continuation with the EU4Health program. But there has been also much attention on subjects related to digital skills. In fact, more recently, we've been funding quite a lot training support in digital skills or initiatives that are really supporting let's say the strategies on digital skills, but also green skills, like for example, the Be Well project. I will show you in a minute. Then, as I said, the European semester, the funding instrument like the Recovery and Resilient Facility, and the State of Health that will have a dedicated chapter. And so I invite you to continue to follow the developments on that. So here we see, this is a slide just to show you the investment through the RRPs from countries on health workforce. So there are actions that have, are focusing on improvement of working conditions in primary care, for example, but we also see actions that are supporting task shifting, for example. So the task shifting is when, there are exchange of tasks between different healthcare professional categories, for example, in which, for example, in Denmark but also in other Scandinavian countries, they are supporting a more relevant role of nurses in the healthcare sector, in particular in the primary care setting, which is showing actually good outcomes, but also training. And training to support these different skills development. So it depends really on the countries and the needs. So moving quickly to the targeted EU actions. This is actually a slide just to show you about the medical deserts, task shifting and retention projects that were included in this cluster of 5 health workforce projects, which terminated in mid-2024. We had also a seminar in which this project could disseminate the results, but actually during the European Health Forum Gastein, there was an opportunity for them to continue disseminating the results. So we really trying also to push project to continue actually disseminating about the relevant results. Medical desert, just for you to know, is actually a very important area of work. Means actually it refers to, it is a term used to indicate an area whose population has inadequate access to medical care. So which is quite present in different countries across the EU. So it looks at the healthcare system organization in a wider perspective, actually. So they need to improve access, considering the organization, actually, of the healthcare systems. And then we also had projects supporting retention, in which we really focus on serving on mental health and well-being in 8 hospitals, for example, with interesting results. I will share in the chat the link to this project, so you can also have a look. And as I said, also task shifting with the Tashi project. This is actually a slide that shows you what are the objectives of the joint action, which is EROS, which is funded by the current public health program EU for Health. It is ongoing. It is a very important action involving member states, and we really expect to have results from this joint action, because it is a step forward from the past, because it is really trying to make sure that tools supporting planning and forecasting and these methodologies are really implemented and used in the countries and can really inform policy development. It's really looking at the rollout and implementation strategy to cover identified gaps.
Sabrina, just a small interruption. Could you take your microphone a little bit away from your mouth? It's
sorry.
Okay, now it's good.
Sorry, I have a bit bad cold this morning, so I'm not fast with my voice. You
No
forgive
problem.
me for that. Last but not least, reaching the end of the presentation, I'm happy to announce that the Commission has signed a contribution agreement with WHO Europe to fund an action specifically focusing on nurses, which is quite innovative. As the first one, let's say, that is specifically looking at nurses, because we do know that according to studies, nurses are facing really high job strain and are among the healthcare professionals those that are suffering quite a lot, and therefore we decided to dedicate an action on that. Why WHO? Because WHO has because this action will have to work with different member states, and we do know we needed a strong coordination to make sure that there was actually support support really to member states to address retention strategies, but also mentorship program, and WHO has been working on that quite extensively. So, but they are not working alone. They will involve also European healthcare professionals and social partners associations. So it's a contribution agreement. So it's not actually a normal project, but the idea is actually to make sure that they will disseminate quite a lot and try to involve different stakeholders and actors to make sure in the disseminating the results, so this can have a multiplier effect, a spillover, a multiplier effect. So this has just been signed, so we'll be starting at beginning of next year and will be running for 36 months. And then the Be Well project is ongoing project led by the European Health Management Association. It is actually a project funded through the Erasmus Plus, supporting the Pacts for Skills, which is in the end trying to support a network from different stakeholders representing the healthcare professionals, but also social partners or healthcare organizations, with the aim of developing strategies addressing digital and green transitions and skills. They published strategies. They worked on the strategies for digital and green skills, and these actually strategies is at the moment published in the website with an open online consultations, and I will share the link. So it will be important for different stakeholders to participate to this consultation and provide the input in supporting I will be actually open for quite some time, so there will be time really to respond to this consultation. And then we funded a cluster of 7 training projects dedicated to digital skills. These are very concrete actions of funding really training development addressing in digital skills, looking at different areas like antimicrobial resistance, oncology, or hospitals, and the use of AI, which is becoming quite relevant. And last but not least, here we have a slide dedicated to the EU comprehensive approach to mental health. As I said, this is actually an initiative that is the part of the building the European Health Union. So is really a building block of the European Health Union. It's not my unit directly working on this initiative, but it is very important to mention that, and then if there is interest, we can follow up. But what we can say is that our unit, of course, is looking at, as I said, at the European semester and the state of health in the EU project cycle. And actually in 2023, in the country health profile, we provided a snapshot of the mental health situation in each country, looking at the unequal distribution of mental health problems, the role of stigma and discrimination, and the importance of investing in mental health care and health systems reforms, including mental health workforce. And this is important to say that, you know, this work we do with this data analysis is informing also the EU initiatives and the EU work in the different policies area, including mental health. So that's why we collaborate closely with our colleagues working on the comprehensive approach to mental health. And they are running different initiatives and flagships indeed, and some of them we contributed directly, like for example a survey to identify needs, gaps and obstacles in capacity building of mental health across all policies, and on the mental health of health workforce. Actually, there was, if I'm not mistaken, the launch is today of this survey from WHO, so some colleagues are also following that. There will be further dissemination on that, and also we hope that multiply effect, as we said. And then there is actually an ongoing multidisciplinary training program for health professionals and other professionals. There is a project ongoing on that, which is just started and will be running for the next years. So as you can see, dedicated the part of the comprehensive approach to mental health is really to the role of mental health and well-being for health workforce in the EU. So with this, I conclude my presentation, and I'm happy to answer to possible questions. And sorry for my bad cold this morning.
Thank you very much, Sabrina, for your very detailed and comprehensive presentation. I think we took a bit of time, but that was worth it to discover all these activities. I will now turn to Jirka, or Jirka is maybe easier to pronounce. Sorry for the mispronunciation of your name. And we will take question after your presentation, Jirka. You're going to talk about long-term care.
Yes, thank you, Claire, for these kind words. I mean, your pronunciation is just perfect. My presentation is going to concern long-term care EU approach. I'm well aware that this seminar is not really focused on long-term care, but as you all know, long-term care is overlaps in many ways with the healthcare sector, as nurses constitute quite a significant chunk of the workforce in the long-term care sector. Long-term care happens to be a sort of overlooked sibling of healthcare, and all the problems and challenges that the healthcare sector faces are in many ways much worse when it comes to the health long-term care sector. So to start with, my presentation is going to be focused on basically three different areas. First one, I'll try to outline the current situation in the long-term care sector, backed up by data and statistics. After that, I'll run into possible solutions that are stated in various sources in the literature, and finally I'll focus on the EU action in this particular area. So to start with, causes and negative effects of the current situation. My first slide already shows that there is sort of a vicious circle of a chain of problems that keep reinforcing each other. There is the situation with low wages. There are difficulties to attract skilled labor force. There are the problems relating to high workload, and of course there is a price to be paid for all of it in forms of.
Excuse me, Jirka, are you moving your slide, because we are still on the first one? The one okay.
Yeah.
Thank you.
Is it okay? Yeah. Sorry for that. Yeah, it's just to get to the facts and figures. Long-term care workers usually earn 20% less than their counterparts in the healthcare sector. Of course, there are significant differences between different member states, but still, this is a huge problem. There are recruitment challenges, and of course, also very important worker shortages. This constitutes one of the crucial points, because unless, of course, the economic logic speaks clearly, unless the wages are made higher, the recruitment challenges will remain. When we move on, and I hope you can all see the next slide, I'm going to talk about shift work and health risks. This is a very important area. The shift work has many consequences for the healthcare workforce. It impacts the leisure time, the weekends, the holidays, and it's very obvious that, and there's also data that backs it up, that almost 30% of shift workers report chronic fatigue. That's a very high number. This is also kind of one of the key challenges of the long-term care sector. Then when we move on, there is a phenomenon of the exposure to aggression. It's partially and to a certain extent also faced by the health workers, but in terms of the impact and the extent, the long-term care sector suffers significantly from the exposure to aggression, as you can see the numbers. And again, the continuous exposure to aggression leads to anxiety, elevated stress, and psychological problems of health long-term care workforce, which again leads to the same problem of the recruitment and retention of long-term care workforce. When we move on, I would shortly also touch upon the issues, physical and mental health risks. As you can see, the figures and the situation is not looking that good. I'll move on now to one of the last points on the current situation and causes and negative impacts. High workloads and stress again form in a way never-ending chain of bitterness for the workforce to deal with. Now we move on to possible solutions. I know that we are out of time already. One of the keystones that you can find and linchpins of possible solutions is training, reskilling, upskilling, but continuous professional training and development is one of the most important prerequisites in order to be able to turn the tide. And the Commission has also...
Sorry, Jiri, the slides are not moving.
Not moving again. Okay, so...
Okay. Thank you. And I think we can allow perhaps 2 more minutes on the solution.
Yeah. If I move on, then flexible working arrangements are also a way of addressing the problems, and there is also the possibility of peer support and mentorship. As outlined, I won't go into details when it comes to these things, and move on to the role of the EU. I will basically echo what Sabrina already mentioned. The competence, the EU competence when it comes to long-term care is limited to a great extent. Basically, the EU can complement the action of member states and support them in their efforts. In order to achieve that, in 2022, there was proposed and also negotiated and finalized Council recommendation long-term care, which is based off a broader European framework of EU care strategy that was launched at the same time, also relating to the EU funding. Now the long-term care also features in the European semester, of course. The Council recommendation covers all the important aspects and features of this sector. Again, due to the lack of time, I won't go into details, but it deals with vulnerable workers, stakeholders involvement, career pathways, skills requirements, and awareness and communications. Member states, in the Council recommendation, there was a deadline for member states to submit their national reports on the implementation of the recommendation. And now the Commission is at the stage of analyzing these reports, and in 2027 it will publish a report on the implementation of the recommendation. As I said, the broader framework is EU care strategy, which focuses in terms of the working conditions on improving the working conditions, reviewing the application of EU standards, and of course funding research on the Horizon projects. A lot is in the care strategy devoted to skills development, and of course the EU need more quality and timely data. So the evidence-based approach is taken, and a lot of research projects are funded through the EU money. Then this slide is once again about monitoring, and I'll probably finish at this point, and I'm more than happy to take your questions. Thank you very much.
Thank you very much, Jirka, for this overview of long-term care, and I like your wording of the overlooked sibling of healthcare, because this is often the case that sometimes we don't realize that many of the challenges are common in long-term care and in healthcare, while there are also some specificities. I haven't seen any question in the chat, and I know we are running out of time already, but if you could just tell us in one word what is your vision in the future? Do you see some improvements? Are you optimistic, or are you pessimistic for the future of the workforce in long-term care? Just in one word, and I will give back the floor to my colleagues.
I need to be optimistic. The situation is changing. The demand is growing, and it will basically, the electorate will make sure that the politicians will sooner or later start to listen to what is needed in the member states. So I'm optimistic, but it might take longer than all of us would wish. Yeah, thank you.
Thank you very much, and we will certainly be there to watch the progress and ask for quicker implementation of policy. Thank you very much, Sabrina. Thank you very much, Jirka. You're welcome to stay with us with the discussion, but we know you have lots on your plate, so you perfectly understand if it's not possible for you to stay. Over to you, Shalini.
Yes, thank you. Can you all hear me now? Yes, I just needed to check that my audio was working. Thank you. Thank you, Claire, Sabrina, and Yitzi, for sharing your insights into EU policy. This has given us a really good foundation and really set the stage for understanding the importance, the relevance of the projects we're about to hear about. Since we're running a bit behind schedule, let's jump straight into the project presentation session, where the leaders of each sister project will present their work. We're going to start now with Professor Siri Vik, who's the coordinator for the Support for Resilience project. Over to you, Siri.
Thank you very much, Shalini, and thanks to Sabrina and Jiri for their brilliant introductions. It's really, really nice to hear you. I'm going to share my screen, and you will have to tell me if you see it, Shalini. There we are. Okay.
Yeah.
So then I'm really delighted to present our project, which is called Support for Resilience, Strengthening Resilience and Mental Wellbeing through the Support for Resilience Toolbox for Leaders in Elderly Care. And I'm coordinating this project from the University of Stavanger at the SANTE for Resilience in Healthcare. And we're really delighted that the EU is funding our project, but the EU doesn't have a role in the work that we're doing. So I would really like to thank for the funding. Here you see the partners in our project. So we are 14 partners in 9 countries. It's coordinated from Norway. We have 2 partners in Norway, 2 in Finland, 1 university in the Netherlands, and European Forum for Primary Care, also located in the Netherlands, ISQA from Ireland. 2 partners in Spain, 2 in Italy, 1 in Romania, and 1 in Cyprus, and 1 in Australia. So thanks for all of them for joining. We are funded by the EU Horizon Europe Destination 4, but we are also funded by the Australian National Health and Medical Research Council, because our Australian partner is eligible for funding when we were granted from the EU. So we are really grateful for having both the EU support and the Australian support in this project to make it a bit bigger and to also include Australia in what we are doing. So the problem that Support for Resilience is addressing is the European elderly care and how we experience labor shortages and lack of qualified healthcare workers and a major mismatch of capacity and demands in healthcare services, which is causing stress, burnout, and reduced mental health and well-being among healthcare workers, leaders, and informal caregivers that the previous presentations have nicely illustrated. So this is kind of the backdrop of what we are going to do in our project and trying to help reduce this problem. And our project focuses on the need for healthcare leaders and how they need much more research-based tools and interventions, better training to map and understand and act upon these capacity demands challenges. And our ambition is then to go beyond the state of the art by developing, implementing, evaluating a research-based digital support for resilience toolbox to support healthcare leaders in promoting resilient performance and mental well-being. And to the right here, you see a visualization of the idea of the toolbox, which includes 3 tools. The first one is focusing on mapping and identifying the current status in organizations. The second part of the tool focuses on how leaders can increase reflection and educational elements in their workday. And the third element of the tool is focusing on how can we reorganize based on the situation in the services. Sometimes you might have to de-implement and reorganize what you're doing. So through this Support for Resilience toolbox, our primary objective is to support the leaders in elderly care across Europe to improve resilience and mental well-being in the healthcare workers and informal caregivers by integrating their perspectives and suggestions for improved working conditions. And more specifically, our secondary objectives are first to map and identify resilience and mental well-being factors among healthcare workers, informal caregivers, and leaders in elderly care in 6 European countries and Australia, to provide an integration of the contextual related factor, geographical location, gender elements, and capacity demands challenges. And secondly, we will explore the needs and perspective among the healthcare workers and informal caregivers, how we can enable successful adaptations to changing working conditions, the ethical dilemmas they are facing, and the adverse events, and also to try to identify possible solutions. Based on this, we will develop a digital support for resilience toolbox for leaders to promote resilience, performance, and mental well-being based on the workers and informal caregivers' characteristics, their needs, involvement, and suggestions for improvement. And fourth, we will implement and evaluate relevance, effectiveness, and cost-effectiveness of this toolbox in different healthcare systems in 6 European countries and Australia. And we will, based on our research, establish new theory to scientifically describe the relation between individual and organizational resilience, mental well-being, and the role of leaders in promoting it. And we will also develop and disseminate recommendation and cost-effective interventions for policymakers and leaders through an open access online digital support for resilience resource bank. So these are our secondary objectives. And one of the key elements in our project is the integration of organizational resilience, individual resilience, and mental well-being. And we will go in the organizational resilience from a need for tools for operationalization to a toolbox that will provide leaders with abilities to strengthen resilience in elderly care. At the individual resilience, we see currently liability of coping is put on the individuals. Through the toolbox, leaders will have support, be able to support staff through organizational structures. And in the mental well-being area, we see that interventions currently are aiming at individuals are less effective for change. And through a toolbox, we will support cultural change and adaptive capacity from the organizational level. And we see leaders as the catalyzers for support and change. And this is also shown in this figure where leaders to the power of the support for resilience toolbox, we will increase awareness of the current status in organizations. We will improve understanding of how to handle a situation, and we will improve the system through reframing practices and structures. So here you see a kind of a visualization of the support for resilience work process, and we are at the left of the figure at the moment, focusing on literature summaries and data collection across countries that we will use to co-design the toolbox and prototype test it before we implement and evaluate it. I have a final toolbox and new theory, policy recommendations, and a resource bank available. We have an adaptive research design where we will collect data from both healthcare leaders, healthcare workers, and informal caregivers. And we will do this through 4 different test cases. We will, in Norway and Finland, conduct a cluster randomized controlled trial in public home care services. In test case 2, we will do a before and after study with public residential care institutions in Spain. In test case 3, we are focused on private residential care in Italy and the Netherlands. Also here we will have the Australian partner coming in. In test case 4, we have a public hospital to home context in the Romanian context. Furthermore, when we look at the evaluation of the project, we will have a thorough evaluation process. Just recently, we are collecting the data to start and to Informal toolbox and how it will look like. When it's developed and implemented, we will do a process evaluation of the intervention that will go on for a year. We will do effectiveness evaluation to see if the toolbox is effective, and also the cost effectiveness assessments will continue after the year to see the effects of the cost of our intervention and the toolbox. The resource bank is what we will have in the end, where we will make everything available for the audience and whoever would like to do this and take advantage of our knowledge. So the Support for Resilience Toolbox will be available. It will be available in 6 languages. We will develop tailor-made policy recommendations and theoretical frameworks where we integrate individual organizational resilience and the mental well-being and how leaders play a key role. We will make the intervention design available so others can repeat it. We will see the role of different management models because we are operating in very different contexts in the European setting, but also from the Australian side, and all the publications will be made available. And if we're looking at the impact, it relates heavily to what we have heard in the previous 2 presentations and how we are focusing on the leaders in our project as a kind of a source to help the many. Targeting the few leaders will help the many, and we will develop better working conditions for healthcare providers in elderly care. We will integrate individual resilience, mental well-being, and organizational resilience elements into the toolbox to have a holistic perspective on how to improve services in elderly care and the work situation. The toolbox will have impact focusing on improved working conditions and mental well-being for the workers and informal caregivers. It will provide leadership support and new skills because many of these leaders are not trained in these type of elements. We will help them here. And this is hopefully reducing the capacity demands gap, and we will be able to involve workers and informal caregivers in new ways. This is varying heavily across different countries and contexts and what's normal. So this is an area where we'll heavily focus on the involvement element. Also, our project will focus on retaining and attracting workers and to produce cost-effective interventions. Here you see kind of how the work packages are linked. We will not focus so much on that. We are focused heavily now at the moment on the preparations and for the data collection. We have just actually started data collection, and we will do that in the different countries to feed into the toolbox development. Here, yep, I'm finishing. We are in year 1. We started in March, so we are in month 8 at the moment, focusing on the literature and the data collection, and a lot of fun going on at the moment. So that concludes my presentation. Thank you, Shalini, and I will try to stop sharing.
Thank you so much, Siri. So we have some time for questions. You can either post your questions in the webinar chat, or you can feel free to just speak up and address Siri directly here.
I cannot see if there are anything in the chat, Shalini.
I'm checking the chat, but there's nothing in the chat as of now.
There's a question from Irene, I think. Nope.
No. If anyone has a question, please just unmute your mic and ask. It's absolutely fine.
It's just a fake hand. All good.
All right. So what we'll do then is then go on. Oh, there is a question on Slido. Let's see. The question series is, what does care leaders, in quotes, mean specifically in the field of informal caregiving?
Yeah, we are mainly in the context of nursing homes and home care and hospital to home. So these are the leaders. Most of them will be frontline leaders that we are addressing. And some of them will have contact with informal caregivers, like for in the hospital to home context or in home care, but also in nursing homes, there will be contacts with informal caregivers. But mainly our target group for the intervention is the leaders, but our effect will be shown on the workers and hopefully on the informal caregivers.
I can't see any other questions. So if it's all right, maybe we can move on. You're welcome to just post your questions afterwards. Just indicate who you are addressing when you post your questions. We will now move on to Dr. Leonard Magnusson from the WellCare Project. As I mentioned earlier, he's stepping in for Professor Elizabeth Hansen, who is the coordinator of the WellCare Project, but unfortunately she couldn't be here. So Leonard, over to you. Please start your presentation.
Thank you, and thank you for the possibility to present our project WellCare. It really, in the main, is transforming care and empowering lives. But the title of the project really say what it is about. It is investing in mental health and well-being of informal carers and long-term care workers by identification, evaluation, and promotion of good practices across Europe. And our target groups are the long-term care workers. That's qualified nurse, personal care workers, employed by long-term care provider or directly by care recipients or family. And it is also the informal carers, persons who provide usually unpaid care to someone with chronic illness, disability, or other long-lasting health and or care needs outside of a professional or formal framework. Nearly all of this is at home, in their own home. And we have 6.3 million people working in long-term care sector in the EU, and more than nearly 10 times as many are informal carers. 52 million in the age of 18 to 74, but we have also many older, 75 and older, who works with giving their loved ones care at home. And you can see it's similar. The staff have low wages, irregular working hours, heavy workload, and adverse social behaviors. The carers, the informal carers, suffer from burden, anxiety, depression, and difficulties to balance care, work, and private life. And we are normally used to see them as two disparate groups, but there are a lot of things that are common, and they are really more like being interconnected. And the base for our project is a European care strategy, where the informal care and long-term care professionals are really mentioned, and there are created tools for working with it, and it's up to the countries now to take this further on and create a framework of policy reforms. And our goal is to strengthen support available to long-term care workers and informal carer for improving their resilience and mental well-being through care partnership. And we work to improve working and caring conditions to be well and care better. 48 months transdisciplinary and participative project where all stakeholders are involved. And we have in total, we have 15 partners. We are focusing on five countries in Europe. It's Sweden, Germany, Netherlands, Italy, and Slovenia, all with differences in the welfare system. We have 6 research partners, 5 in Europe and 1 from the States. We have NGOs for informal carers, 4, and 1 knowledge translation center. They are in the 5 countries, and we have 4 European NGOs advocating for mental health, long-term care workers, informal carers, and care providers. But together they have more than 350 national, regional members around EU. And our approach is research and advocacy together. And together is important. Partnership is important. Multi-level perspective to look at both individuals, organizations, and society, and to have an integrated long-term care, working with participatory research and mixed methods evaluation. Key concepts. Our user and stakeholder involvement is very important, where we work with blended learning network. That is a creative network for informal carers, long-term care practitioners, health and care managers, decision makers, policy makers, NGO, unions, researchers, and other stakeholders. They share their knowledge and experience with each other, learn from each other. Also, the project working as a sounding board, giving inspiration, validate and give feedback. Project puts. We have 1 in each country, 15-20 people, meets regularly during the whole project, approximately 5 times a year. Resilience is another key concept. Resilience on both individual and community level to adapt to their adversity, taking into account both the individual's internal resources, but also the social environment and the availability of resources. So it's an integrative process with both psychological, social, and systemic factors. And care partnership. By care partnerships, we mean the coordination, integration, and mutual recognition of care and caring activities performed by informal carers and long-term care workers. Our activities, we identify good practices. We will develop, test, and validate 5 to 8 innovative solutions in the 5 countries. We are analyzing policy and provide recommendations And we will establish a sustainable research, innovation and sharing process involving the key stakeholders. The outcome so far is the outcome of the project, a set of support measures to address the mental health and well-being of all carers, setting up blended learning networks, national ecosystem, identify 40 good practice, test 5 to 10 prototypes with 500 end users, publications, policy recommendations. And we have expected impacts to create a realistic and credible pathway for working with this and communication, dissemination, and exploitation during the project. And what we have achieved so far is the systematic review of good practice, where we have gone through the literature and looked at grey literature. And 139 scientific articles with good practice are identified, of which 28 have a specific potential for care partnerships. And of the grey literature, 103 good practices and 52 show specific potential for care partnership. Then we have done analysis of legislation, policy, care frameworks and funding schemes. And we can see, and we will show in the report that comes next week, the difference between the countries with welfare, legislation, socio-political context. And we have also formed some recommendation for the member states to also always focus on the mental health of informal carers in all policy and a comprehensive strategy to address psychosocial risks at sources for long-term care workers. And to EU, to mainstream mental health in all EU policies and allocate funds for the work. This is the lovely picture with all the logos of the partners. And this is the email address for the project and the contact details for Elizabeth and also the website. And we have a newsletter and we are available on LinkedIn. So thank you.
Thank you so much, Lennart. Impressive that you've pulled this all together literally in the last minute. Well done. We are opening for questions to Lennart as well. But in the question and answer section, we have a question for Siri, which is from Stefano Pellegrino. And he asks, I recall that the 4 test cases for the toolbox are entirely made in Europe. Could you clarify what Australia is contributing in terms of empirical or scientific input?
Yeah, so the Australian partner, they have their own funding to actually do what we are doing in Europe. So that's really cool. So they are now doing the same data collection for the workers and the leaders, not the informal caregivers in Australia this round because they don't have enough funding. They are feeding into the toolbox development with the reviews and with their kind of country information and the context mapping that we are doing in all countries. We are also doing that in Australia. This feeds in, and they will do a test case in residential aged care facilities in Australia, and the same as we are doing in Italy and the Netherlands. So that the sites will be similar. They will test it and use the same data collection tools and evaluation that we are. So we are really proud to have them involved. So they were eligible for applying for funding with them so that they actually could do the research too. So I hope that clarifies. Thanks for the question.
Thank you, Siri. We have a question from Marco Sochi, who's raised his hand. Marco, is your question to Lennart or to Siri? Are you there, Marco? Can you hear us? Or maybe there wasn't a question.
I think he has muted his microphone.
Marco, would you like to try again, unmuting yourself? While we wait, I can just say that there was a question posted anonymously asking if the presentations will be available after the webinar. And yes, all presentations will be made available to participants.
If Marco cannot unmute himself, then Marco, maybe you can write the question in the chat. There seems to be a problem with the audio.
Yes, can you hear me?
Yes, we can.
Yeah. Well, I have not just a question, but I would like to thank Lennart for presenting the project. We as IRCA participate in the project and think that this event could be very useful for sharing knowledge about these projects, and it could be also useful to share the presentation after the event and also have potentially other opportunities to exchange during the process of the implementation of our projects. Thank you.
Thank you very much, Marco. And yes, as we mentioned, we will be sharing all information after this webinar. Are there any other questions for Lennart before we move on? I can't see. Is there anything on Slido maybe, John? I'm not on the Slido page, but... Okay, I think we can...
No, there's nothing on Slido.
No. All right. So moving on, we have our final project presentation, which is from Professor Irene Georgescu, who is the coordinator of the Apollo 2028 project. Please, Irene, the floor is yours.
Thank you very much, Shalini, for inviting me, and thank you very much, Siri, for inviting me. So I'm very proud here to present you Apollo 2028 presentation and project. Just to take the context, even if some previous presentation have explained the context, we know that physical and psychological health and well-being of healthcare professionals is critical for successful healthcare delivery system. Despite heterogeneity of healthcare delivery structures across and even within countries, they often face similar challenging common problems which are linked to their daily practice. Intense context, uncertainty, crises such as pandemic or recently extreme climate events increase the pressure on healthcare professionals. During the COVID pandemic, many papers have mentioned that healthcare workers have experienced social isolation, depressive symptoms, emotion exhaustion, and trauma symptoms such as burnout. And actually, we know that action is needed because this phenomenon can have observable effect on patient, especially, for instance, in emergency care. That's why we have created a consortium. This consortium is, I hope you can see my screen. Yes, this consortium, oh, sorry, is consulted. We have 8 universities: University of Montpellier, Abo Academic University, Bocconi University, ELT from Hungary, Kaunas Technology University, Karolinska Institute, Trinity College Dublin, and Vilnius University. In the team, we have 3 university hospitals: Centre Hospitalier Universitaire de Montpellier, Centre Hospitalier Universitaire de Nîmes, and Massachusetts General Hospital, and we have 1 company in Europe. So these expertise are from different disciplines. We have psychologists, we have health management and organizational studies academic, health economics specialized in healthcare, artificial intelligence tool developer, and medical practitioner. So the aim of this project is to provide healthcare worker, leaders, organization, healthcare system founders, and policy maker innovative solution, research-driven, to improve mental health, well-being, and resilience to face changing environments, such as daily pressure and extreme events in the workplace. So to that purpose, let me present you the project in overall. We have several objectives. This is a big panorama of the project. The first objective is to study and identify at the individual level factors which can affect positively or negatively physiological health, mental health, well-being, and resilience of healthcare workers. We focus on doctors and nurses in hospital, public hospital, and private hospital. So to that purpose, we will collect data, physiological data, drawing about a tool, and the name of the tool is Human Health Passport and Human Health Passport method. And we will collect mental health data, and we will conduct longitudinal research as individual level to identify among different variables such as high stress, burnout, gender, age, which factor can have an impact on the level of resilience, because the level of resilience will be the dependent variable. Then, in the organizational factor, which will be the objective 2, we will study and identify at the organizational level what could be factors which can affect positively or negatively mental health, well-being, and resilience of healthcare workers. So to that purpose, we have already conducted a literature review. It has been object of a deliverable. And actually, we are conducted some qualitative interview. Then we will conduct quantitative interview to test what kind of organizational level variable which can affect healthcare professionals. And we will collect data in different geographical points, such as Finland, France, Ireland, Italy, Lithuania, Sweden, and USA. The WIP3 team factors is linked to the specific objective 3, study and identify at the meso-organizational level, such as team and middle management and middle manager level, what could be the factors which can affect positively or negatively mental health, well-being, and resilience of healthcare workers. In the same dynamic, we will conduct a scoping review, and this scoping review have been the object of a deliverable. And we will conduct qualitative interview and quantitative interview to try to identify what kind of factor which can affect at this level healthcare professional. And we will collect data in Finland, France, Ireland, Italy, Lithuania, Sweden, and USA. Then we go to the WIP4, the interplay between individual, organizational, and team resilience. So the specific goal here is to understand what could be the interaction between the different levels, and we will provide some managerial tools. So drawing on the results we observe in the WIP1, WIP2, and WIP3, then we will look at the interplay between the different types of level of resilience, and we will provide a new form of training to team manager and director of hospital, and we will develop a scenario analysis such as software tool to try to help manager to take a decision in a specific context. And the sample, which can be concerned by at least a training program, will be France, Italy, Lithuania, and Sweden. Then the specific objective 5 is to provide healthcare system founders with cost-efficient solutions to improve the mental health and well-being of healthcare workers at the individual, organizational, and sector level. So put differently, we will study the economic factors such as invest, cost generated, cost avoid, and cost effectiveness of the solution we will propose on the objective 4. And we will finish by dissemination, but at the end, the dissemination is not the end, but we will have it during all the journey. We will share, obviously, the results with academic, but with society and with healthcare professionals and director. So what will be our impact? First, the impact to who? The impact concerns healthcare worker, hospital service manager, and human resource manager in hospital, obviously policymakers which are involved in the healthcare system management in local, regional, national, and European level. It concerns to private and public healthcare system founders and organizations. Patients will be concerned, citizens who have an interest in healthcare delivery, and obviously other researchers in the field. Impact on what? Here we have 3 pillars. The first one is scientific impact. The purpose is to create a high quality knowledge, try to make a diffusion of this knowledge, and obviously promote scientific excellence. The second impact is an economic and technological impact, because the target is to look how is it possible to reduce the cost of labor in healthcare sector and improve the labor condition. And to finish, the last impact will be a societal impact, because this project will address to European policy priority and global challenge for improved well-being, mental health, and resilience of healthcare workers. We will delivering some mental health support program, training, artificial intelligence tool, but very close to what is needed from manager to improve working condition in healthcare settings. And the last societal impact is developing cross-border collaboration and best practice sharing within and outside Europe. So I invite you to follow us. We have a website and we are still in LinkedIn. Thank you.
Thank you very much, Irene. That kind of brings us to the end of this set of presentations, project presentations. There is time still for further questions. I can't see anything in the question answer box, but if anyone wishes to speak, please do so. Can't really see much happening. We are running a little over time, so I think since nothing has just really jumped out at us right now, we can maybe move on. I think it's wonderful that we had these project presentations right now. We see the overlap between the projects. We see all the commonalities. And I think it's a right time, John, if you agree to go directly to the interactive poll. Given that we only actually have 20 minutes left, I don't know how much time you want to devote to that, or whether you think we should move straight to the panel discussion.
I think we can go straight to the panel discussion if you would like to. I think that makes sense.
Yeah. Okay, then let's do that. So this panel, as I mentioned earlier, this panel discussion will be chaired by Dr. Magnussen, and Siri and Irene, of course, will be participating. And the aim is to discuss how to better address resilience and mental well-being. So if you all are ready.
Shalini, there are questions in the Q&A.
Yes, I can see that. Let's take the questions first. Shall I read them out loud or?
Yeah.
Yes, so we have a question from Karina Åse, which is, does any of the three projects have a focus on inter-organizational factors or cross-institutional relationships vital for resilience in healthcare? Open to all three of you.
Yeah, I think we can focus on, I can start if you want to. I would say we are actually focusing on the cross-institutional relationships in resilience. I think we will get some of that information when we're doing especially the qualitative interviews, but also in parts of the survey that we are doing, focusing on resilience capacities. But also the system levels are covered, I think, in several of the projects, but how we are able to focus on the relationships. It's a bit early in our project at the moment, but I think we will address it as a really good question.
Maybe if I complete, Shalini, depending the definition of you take about what an organizational is, in the project of Apollo, we will look at the different level too.
Yeah.
Do you have any comment?
Yeah, I can say that. In a way it depends on if we find a good way of working with partnership. We will look at that both on the individual level and on the organizational level and societal. So depends on what kind of prototype we will end up in implementing. But if we come to the societal level, that will probably be between different organizations that has to work. I mean, we have like one example is from the Netherlands today, where the NGOs, the citizens work together with a group of practitioners to create a good care at home and also friendship for the older people. So there is already a way of working, and I think we can create more of that, an example of how that could look like. And of course, if we go from the long-term care, it's people living at home with chronic illnesses, or it is people with disability, then a lot of partners care providers will be involved, like the social care and healthcare and maybe others too. So that will come up in how to do. But the focus isn't on looking at the factor, but it is to see how can we create a resilience in the society. I hope that was not too unclear.
No, thank you for that detailed answer, Lennart. We have two more questions that I'll take up quickly. It is to the first question is to all of you. It is from Stefano Pellegrino, and he asks, is a policy paper envisioned to provide the impact of the project to policymakers? Irene, would you like to maybe start?
I think it will be the target of this project is to provide some suggestion to policy makers. So in a way, we will provide some, we will answer positively to this question.
You will provide input to policy, basically.
Yeah.
Yes.
Oh,
Lennart and Siri? Lennart, maybe first?
Yeah, we will work on policy recommendations, and I think I mentioned one already, or several in the deliverable we will publish next week. So,
Brilliant. Yes.
If I can also follow up with regards to impact on policymakers, because these policy briefs or papers are part of that, but we will also be interacting with policymakers in our work, and also having all projects have partners with different types of, like we have, for example, ISQAN, European Forum for Primary Care, which is also arenas for actually having impact on different types of policymakers in different countries and different target groups. So I think the entire dissemination, communication, exploitation plan will address policymakers at different levels at EU and the national policymakers in each country, and tailor-making recommendations for them to the different contexts. And that is what I see from the different projects, at least. Claire, please contribute.
Yeah, just shortly, as responsible for the dissemination in WellCare, we have really foreseen not only to publish policy paper alongside the development of the project, but in the end, in the last year, to really product some short briefings, podcasts, so a branch of material that is going to be easy to go through, to listen to get the key information, the key guidance from the project for policymakers and stakeholders at all levels. So we really want this to be made accessible to everyone.
Thank you very much, Claire. Very important point. Stefano has a follow-up question for you, Irene, about the policy paper. He asked, how do you plan to do this specifically? Are you planning meeting with policymakers? Do you have a stakeholder mapping? This is to Apollo 2028 project and Irene specifically.
Okay. We have, I see myself twice, but I'm only connected only once.
We can hear you with just the one voice. You're okay.
Great. So it will be here the target of the dissemination. We will have we will identify in fact different type of people who are around hospital, because we focus only on hospital and private clinic, and then we will address to people who are in interaction some recommendations. And I think there was another question.
Yes, there was a question
Yes.
from Henk Parmentier from the European Forum for Primary Care. He asked, most healthcare happens in primary care. Why do you focus only on hospitals?
Okay. We have to make some choice, especially when we look at resilience, organizational resilience, and team level resilience. And because the purpose of this project is to address to director of hospital or manager in fact, some information and some research proposition or tools. Then we try to be as close as possible of what happened within the organization. And it's difficult to look at the organization for resilience as a pathway, actually. And we look at hospital because hospitals play a crucial role in the society too, because they provide a big amount of care to all the citizens in the society.
Thank you. Thank you very much, Irene. Henk, I hope that answers your question. I think given that we have only 10 minutes left, we will move on. Is there another? No, there is no other question. I'd like to move on to the final session, which is the conversation, the panel discussion. Leonard, would you like to lead the way?
Yes, thank you. Now, I was thinking that we start with one question, and please write questions in the chat. We're happy for that. The three projects, they complement each other, tailoring our support in different way. But what do you see as the complementary aspects and the synergy between the projects? If I start with Siri.
Yeah, I was just actually thinking of following up Irene's response about focusing on Apollo's focus on the hospitals, because I think maybe that is one of those areas where we are complementing each other in a very nice way, and which I think is so valuable for us to meet and get to know each other. So the Apollo projects target hospitals, which we know are key stakeholders and actors in resilience in organization and in the society, and also targeting the workers in a hospital context. We know they are really challenged, understaffed, really high pressure. We could see the COVID. So when we were focusing on our project, we were also having to make choices, just like Irene said. So we're looking into what is our project portfolio. We expected some applications to focus actually on hospitals because it was just in the perspective of COVID, a lot of attention focused on hospitals. And we were looking at our own research portfolio, which is heavily focused on both hospitals, but also a strong competence in what I would say more primary care, like nursing homes, home care, GPs, elderly care, we had to call it in the end, because we couldn't find a good concept that covered all countries. So in one country, we have a hospital to home context. In Norway and Finland, we have the home care. In 3-4 other countries, we have institutional, like nursing homes, private and public. And I think we are complementing each other on the terms of the context and who we are targeting. We are mainly targeting the leaders, but we want effect on the many workers and informal caregivers. And I think Irene's Apollo project also focus on leaders and the workers, maybe not so much on the informal caregivers but I'm not sure, which I think the WellCare project is heavily targeting the informal caregivers and their role in long-term care. So we are also what I would see in long-term care in the support for resilience, but maybe even more focus on the informal caregivers in the WellCare project. And I think we are therefore complementing each other. We have similarities. We have multi-level projects. We have focus on resilience from an organizational, from an individual, from different perspectives. We are having a health services research approach, mixed methods. So I think we are complementing each other. We have a adaptive research designs, all of us, I think. So that's at least my point of view. And I think it's really nice to see we have started almost at the same time. And I hope we can repeat these types of sessions, because we are learning so much from each other, and we have different countries that we are covering. So Irene has partners in America. We have partners in Australia. WellCare probably has some partners outside Europe too, and it's fascinating. Not sure what you think, Lennart.
No, I think we complement each other very well, and I think there are synergies and a lot. And of course, we focus on informal carers since they carry out such an enormous amount of care. So what do you think, Irene?
I fully follow you. we are quite good in complementary because we take in fact health in the different points, and the difficulty is to try to catch the diversity in one project, and to try to, it's very challenging to try to provide some solution, because some solution will depend on the context.
But can I ask you also, you have this AI, you are going to work with AI, artificial intelligence. Can you tell us a little more about that? Since it's very on the agenda today, everywhere.
We are actually trying to identify, so I'm not specialized in artificial intelligence, so I cannot speak about it per se, but the target for us is really to develop a tool based on learning and data learning to support a manager in their daily work. So for that, we are actually trying to make, say, not panorama, but an overview of what could be very important in terms of support for healthcare professional in a managerial position in their daily practice.
I can say something from our project if you want, Lennart. We have the toolbox where we will use some degree of AI, but very limited. It's about how we can maybe process some of the data. So this is work in progress in the development of toolbox, and it's of course an area where we need to be very careful about how we can approach it and how we can use it. And so this is work in progress. It's a lot of ethical data management elements affiliated with this. And like Irene, I'm not either an expert on AI, but we have experts on it in our team, and it will be a very low level use in our project. So that's important to say.
Because I was also wondering, when the project is over, how do that toolbox you create, that sounds very important, how will you be able to sustain that one? Will you be able to sustain it?
Yeah, it's a very good question. Yeah, we have a plan for sustaining it and making it available, and also to set aside resources of how to operationalize it. And it's also part of the long-term exploitation plan that we have to do. So we will have a lot of things to think about in order to do it and to make it available, but it's doable.
Yeah, it's important for us. So I feel it's very good that we have 4 years compared to many times before. It's been 3 years. It gives us more time.
Yeah, I think it's really important also to be able to test out and to see. So EU would like us to bring solutions and cost effectiveness and help actually, and tools, and that takes time to develop. So we are basing our toolbox on a previous large-scale project where we developed a digital tool for resilience in healthcare. So that is kind of the previous knowledge base that we have. It's open access, available, everyone can use it. So we are further developing our research based on that. So it's kind of it's standing on other shoulders as well. This EU project too. So it's and I think it's important to also show how we need to step on or to further investigate and try to take this further. Thank you. I see there's a question, our hand here.
Yes, I see Julia Lanfredi has a question. Julia, I see your hand up. Could you maybe unmute yourself and ask?
While we wait, I can just say we try to the sites that will be involved, that when they get involved and they sign their letter of intent, that they also sign up for positive results. They continue with the things we are doing, and also that the organizations involved will continue after the project to support it. So I don't know, are you there, Kira? No. What do Irene says about the sustainability?
I think the dissemination will play a crucial role. So first, the results to support and to justify how far is important to adopt the solution we found, and dissemination, sensibilization to all the stakeholder will be very important. For me, it's a key solution for sustainable development of the result of Apollo project.
Thank you. I can see that Francesca Santula from Mental Health Europe has put in the chat the address to this, who are part of the project address to this documentation. Yeah. We have now reached 1 o'clock.
Claire has raised her hand. Maybe, Claire, did you have a comment or question?
No, sorry, it was a hand remaining from before.
Okay, no worries. No problem.
Thank you for taking part, everyone. Both the presenters and participants who write into us in the chat function.
Yes, thank you. Thank you to all the panelists here, Siri, Leonard, who again stepped in at such short notice, most impressive, and of course Irene. Thank you so much for the discussion. I wish we had more time; it would have been amazing. But we do have to round up now. I want to thank all of you for attending this webinar. This is recorded, so if you weren't able to watch all of it, it will be made available to you. All the resources and so on that have been shared will also be made available to all the participants. Thank you everyone for the part you've played in making this webinar a success. And see you again for the next webinar, I suppose. Hopefully it's not much longer till, given that the projects have so much in common, we can hope that we can continue this collaboration. I see another message here. Yes, Claire also agrees and she wants to do it again. So I think that's a go. Thank you all and have a great evening. Thank you.
Thank you. Bye.
Bye-bye.
Thank you. Bye.
Bye.